So welcome everyone. Since our topic this week is on sex and gender as a social determinant of health, I would like to welcome Lexi Dodds with us today, who is a registered a registered nurse at the UIHC LGBTQ Clinic. And she's just going to talk to us a little bit about health disparities within the LGBTQ population, and also, some suggestions or some strategies to provide more culturally competent care in order to reduce those health disparities. So welcome, Lexi. Thank you for being with us today.
Yes, and thanks for having me. I always love doing these.
Yeah, and we're right in the middle of the COVID pandemic, so unfortunately, no guest speakers this semester. So we're kind of doing the next best thing and spending some time with speakers who aren't able to join us in the classroom. So thank you again. First of all, what I'd like to do is, just provide some clarification with the terminology, so we're kind of all on the same page. So can you explain the difference between sexual orientation and gender identity, and maybe sometimes how people may often get those terms confused?
Yeah. So sexual orientation and gender identity are different concepts. Everyone, including, the majority of us cisgender, have our own sexual orientation and gender identity, and people can change how they identify, and all terminology varies. But sexual orientation is how a person identifies their three physical, sexual, emotional attraction to others, which includes their identity, behavior, and attraction. So for sexual orientation would be how you label yourself as gay, lesbian, bisexual, straight, queer, trans, or something else. And your behavior would be what genders you have sex with, and your attraction would be who you're attracted to. And often in healthcare, we're only concerned about the behavior, but we know who someone has sex with, so we can decide, how we care for the patient and care for them appropriately. And with gender identity is a personal sense of one's own gender, male, female, both, neither, or another gender. So an easy way to remember it is sexual orientation is kind of how your personality is, how you act, and your gender identity is your personal sense of who you are, is an easy way to remember it.
Okay, thank you for that. So within the patients that you've seen and maybe some of the literature you read, what seems to be some of the health disparities within this population compared to their heterosexual counterparts, or even compared to within that population itself?
Some of the main health disparities that we see in the LGBTQ community are they're at higher risk for HIV and sexually transmitted infections, anxiety and depression, suicidal ideations and attempts, substance abuse, increased risk of cancer, and lack of peer or family support, which leads to homelessness, are the main ones that we see in the LGBTQ community.
Okay. So what do you feel needs to happen, or what recommendations would you give for maybe policymakers or clinicians or academia to reduce these health disparities that we are seeing?
I feel like the main thing to help reduce the health disparities in the LGBTQ community is just expanding your knowledge with the community and understanding why they're at risk and why there's a higher chance for them to suffer from these illnesses and diseases.
Great, thank you. So I see you're at work today. So thank you for taking the time out of your busy schedule to be with us today, but tell us a little bit more about the clinic.
So the clinic we started in 2012. We see patients at the Iowa River Landing building and also here at Scott Boulevard where I work. The clinic was founded by Dr. Nicely and Dr. Katie Mborick. It's expanded so much since 2012. We have seen over 1,500 patients, and since then, 80% of our patients travel from outside of Johnson County. We have patients that come from Illinois, Missouri, Nebraska. It's crazy to see how far people will travel to come see us, and it definitely shows that there's a need, LGBTQ inclusive healthcare. And I'm really honored to be a part of that team and to be able to make a difference for that community. We offer, obviously, hormone replacement therapy for our transgender patients. We act as a primary care provider and will manage any chronic illness for them, diabetes, hypertension, do their annual PAPs. We will see gay identified couples and their family. We do OB. We have plastic surgeons that specialize in some of the transgender surgeries. We do the facial feminization surgeries at the U. We also do bottom surgeries for trans women here at the U, which is new to us. Amy Perlman is a urologist, and she's awesome. She's one that does that. And we also do top surgeries as well for trans men. What else do we do? We have our PrEP clinic, which if no one knows what PrEP is, it stands for pre-exposure prophylactic. So it would be an HIV antiviral medication that we give to people who are highly sexually active and high risk for HIV. So we do routine STI checks. And what's cool to think about with the whole PrEP clinic and HIV antiviral medications, if it's taken appropriately, it decreases the risk of developing HIV by 92%, which is wild. Just 30 years ago, multiple people were dying every week from HIV and AIDS. So it's really cool to see that, we have come that far in medicine. So that's one thing pretty popular thing that we do. And we also have an LGBTQ exclusive counseling clinic. What else do we do?
You do a lot. If you go on your website, there's a whole list. I can't expect you to list all of them because there's a lot. But do you see pediatric patients at all? Or is it just okay?
We start seeing, the youngest patient I've seen was about 12 years old. We have a peds endocrinologist that specializes in puberty blockers or kids that young. Her name is Dr. Katie Larson Odie. She's amazing. So we do see pretty young kids as well.
Okay, so I know you had mentioned this before when you came into our classroom last semester, the semester before, but what type of training did the staff receive to?
So on board at the university, they talk a lot about gender inclusive and how, we're here at the University of Iowa, we're very open-minded and we respect everyone no matter their race, gender, sexual orientation. And so we do a bunch of CEUs through, I have the website. But if no one knows what a CEU is, it's a continuing education through the National LGBTQ Health Education.org. And a lot of these, if anyone is interested, are free, and they have tons of free material on there. And it's a great, great resource.
Oh, great.
And
I might have to look at that. Thank you.
Highly recommend that. And just working alongside Dr. Mborick and Dr. Nicely, they teach you a lot. And I feel like you as a professor introducing this to your students, and I've done some lectures and guest speaking for the College of Nursing, it's gonna change medicine. I feel like the way we care for patients, and it's gonna be a normal thing.
Great. So I know you have a busy day ahead of you, so I don't want to keep you too long, But just in closing, because the majority of the students, will be going into some type of profession within the healthcare system. So do you have any words of wisdom or any suggestions for these students in their, in their future interactions with patients, how to provide more culturally competent care, especially within this community?
I think the top thing is definitely expanding your knowledge and know your LGBTQ definitions. Expanding your knowledge will help you identify the risk factors for your patients and seeing what they're for. STDs, homelessness, anxiety, depression, suicide, and also just be inclusive. Make sure that you are showing that you are an inclusive person and that they can feel around you. And wherever that you work in your workplace one day, if you don't feel like your facility or healthcare center is being inclusive for that community, you can approach them and ask them to be more inclusive and use more, expanded terms. And also it's best to convey respect to the patient. Sometimes people may feel like, oh, I'm going to use the wrong pronoun, I'm going to use the wrong term. You just have to ask open-ended questions. And sometimes when I approach new patients, I say, hi, my name is Lexi. I'm going to be your nurse today, and I use the pronouns she, her, and hers. What pronouns do you like to use? That's a great step for our trans patients, or if you ever care for trans patients. And the last thing is, if you ever see a peer or a coworker being negative and not showing respect, it is okay to approach them and be professional about it, because it honestly starts with you making it a better place and making it a comfortable place for our patients.
Great. Well, thank you for those recommendations. We sincerely appreciate them. So I just want to thank you very much for your taking the time today to talk with us today. And take care, Lexi. Thank you again.
Thank you. Bye.
Bye.